Well, during this American Heart Month, one of our goals is to make sure all of you watching at home know when you need to call a doctor, because too many times people, and especially women, ignore the warning signs.
You're about to meet a woman who is very lucky to be alive.
And the doctor at Starling Physicians wants us all to learn from stories like hers.
Judy Odishu of Berlin was suffering for years from something called angina, but she kept dismissing it.
I'd be carrying bags of groceries up my walkway, which is quite a distance from the house, you know, to the front door. And I'd get really short of breath and tired.
Judy's cardiologist, Dr. Shashir Mather of Starling Physicians, says many people don't even know what angina is.
What is angina?
Angina is a symptom that people feel because of lack of blood flow coming to their muscle of the heart.
Judy rationalized her symptoms for 3 years until she was on the brink of what could have been a deadly heart attack.
I was just going with it and kept saying, oh, it'll go away, it'll go away. Probably a lot of denial on my part.
Dr. Mather wants to help people identify the symptoms of angina so they don't deny its warning signs.
The symptom can vary anywhere from pain to feeling of heaviness, just discomfort, heartburn-like symptoms. Some people feel tightness in their throat. A lot of patients often dismiss it as either heartburn or some kind of a musculoskeletal pain and do not seek attention in time.
Because it could be a sign that you are in danger of having a heart attack.
Absolutely. When people continue to progress with these symptoms without any treatment, sooner than later, a large percentage of these patients may end up with major heart attacks or sudden death.
That's what happened to Judy's girlfriend, who had the same symptoms Judy did. After her sudden death, Judy came to Dr. Mather at Starling Physicians in Wethersfield to get checked out. Dr. Mather looked inside of Judy's heart with a catheter and
He said, you have an 80% blockage. And I went, oh my God. And he says, we're admitting you to the hospital. He says, you're gonna need surgery.
Dr. Mather used coronary angiography to see what was going on inside of Judy's heart. That's when doctors inject a contrasting dye through a catheter to show where there are blockages. Here's an example.
The dye flow is very slow through this whole area. So this is a severe blockage in the artery.
With Judy's artery showing an 80% blockage, she was admitted for an immediate bypass surgery, something that stunned her friends and family.
He went out and talked to my daughters, and they were like stunned. Nobody could believe it because I never told anybody.
Thankfully, Judy lived to tell her story.
So how have you been feeling since your surgery?
I have been feeling wonderful. I can't believe how good I feel.
Excellent. So no more chest pains?
None.
Today, at 83 years old, Judy goes to the gym most days and no longer feels winded when she walks.
I would say that if you are experiencing any kind of chest pain and shortness of breath, it doesn't hurt to go to the doctors. I know that now. I would never do that again.
So if you're having any questions, make sure that you get it checked out, anything in your chest area, and you can get it checked out right at Starling Physicians. They have several locations around the state. They also have a new congestive heart failure clinic.
Yeah, patients can get the procedures all in one place outside of the hospital at a new infusion center in Wethersfield.
Yeah, so that's great for people suffering from congestive heart failure. For more information on Starling Physicians, all you have to do is go to starlingphysicians.com.